prostate, coronal, planar anatomy. I've taken a representative section, although remember, the anatomy is going to vary a bit as you go from front to back, because in the back of the gland you're going to have mostly peripheral zone, and you're going to appreciate that when we look at a live example of a prostate on MRI. But let's begin. We've got the transitional zone, which is periurethral. We've got the urethra and the periurethral tissue, and the transitional zone is seen here in yellow. Now, the transitional zone, as you age, is going to get bigger, and it often has sort of a globular look to it. You know, it expands much like this, almost like two half bowling balls or two bowling balls on each side. So it's going to get bigger, and as it gets bigger, it's going to start to press into the central zone and press into the peripheral zone. The same thing is true of the central zone. So the central zone is labeled here in orange. So let's do something to the central zone. Let's make the orange area a little bit bigger too. So as you age, that's going to get bigger as well. And that's also going to press into the upper lateral portion of the peripheral zone. Now the peripheral zone is seen here in brown. And you can see it's a pretty large structure. What makes MR so valuable, though, is not seeing this area, but it's seeing this area down low, which is so hard to analyze by physical exam and even by visual inspection and biopsy. It's just a hard area to get to. And a lot of cancers occur down here. Most radiologists don't think to look down here. And also anterior in this area is where the fibromuscular zone is located, which is dark, and cancers are dark. So you have to kind of really tease out what's normal tissue and what's cancer, and you use the diffusion image to do that. I'm not going to talk about the actual zones. If you go to the axial vignette, it'll give you the zonal abbreviations for a lot of these areas, and I do my zone mapping or descriptors in my dictation almost always off the axial projection. We also have the seminal vesicles, which are secretory glands that contain proteinaceous fluid. Although they may be desiccated, they vary in their signal intensity. We've got the ejaculatory ducts or ductus deferens, and then two other important structures. The margin between the central gland, remember the central gland, consists of the central zone and the transitional zone. So all this is central gland. It is separated from the peripheral zone by something called, seen here in white, the surgical capsule. That is really important, because when you have a cancer in the central gland, it is often a thick lentiform structure. I'll make it black. It's kind of charcoal-like, as opposed to, say, a nodule, which is round. And usually the round, well-defined nodules, most of the time in the central gland, are benign, but the charcoal-like lentiform abnormalities are not, and they will subtly cross over the surgical capsule. And then you have the peripheral anatomic capsule, which is the outside of the gland, and what's around that? Oh, lots of little vessels. The perivenous plexus, or the periprostatic plexus, is located around here. And you saw in the axial vignette that you got the neurovascular bundle posterolateral at 5 and 7 o'clock. So that's our coronal basic diagram of the prostate gland. Remember how important the surgical capsule is, differentiated from the anatomic capsule. And remember that there's going to be some change as you go from 30 years old to 80 years old in the amount of central gland tissue that's there. It's almost always going to be bigger as you get older.